I like to travel the way I live, prepared for any eventuality. Hello, my name is Dr. Monica Flores, a pediatrician in South Florida since 2001, and today I'm going to review the medications I keep in my luggage when my family travels. Our family has been blessed to be able to travel the world, and during those travels, inevitably, somebody gets sick. Cuts and scrapes in Italy, asthma attacks in the Philippines, and tummy bugs in Singapore. Traveling with a well-equipped first aid kit has benefited my family and my patients. Listen until the end to see how you can obtain a PDF version of what I pack in my travel first aid kit. My first aid kit is broken up by symptoms, then by the medications that you would use for those symptoms. First are medicines that you would use for cold and flu. Saline is physiologic, related to our normal anatomy. It's safe to use in all ages. It comes in a spray, or my favorite, a gel. You could also travel with saline rinse packets, little packets of salt that you then mix with sterile water that can be used to rinse either your nose or wounds. Afrin is a spray decongestant. It must be used with caution. If it's used longer than directed, it can cause rebound congestion. It's great to use for 1 to 3 days if you have a stuffy nose. I love steroid nose sprays. Spray decongestants like Flonase or Rhinocort, Nasonex. Use 1 to 2 sprays once to twice a day for allergies or chronic congestion. If your child or you tend towards a sensitive nose, a nose that gets itchy or stuffy with perfumes or cigarette smoke, these steroid nose sprays are a great thing to have on hand. Antihistamines are medicines that are used to dry up your nose. They do have the side effect that they dry your mouth, eyes, and everything else that produces liquid. If you have allergies or a runny nose, they are great to use. The strongest of the antihistamines is Benadryl. It does cause sleepiness. You can also use the non-sedating, the not sleepy-causing antihistamines, things like Cetirizine, also known as Zyrtec, or fexofenadine, Allegra, or loratadine, Claritin. You can use one or the other, and they should not be mixed. They are safe to use in children 6 months and above. If you do not know the dose, ask your provider. There are D versions of the antihistamines, Zyrtec D, Allegra D, Claritin D, that have a decongestant in them. They are found behind the counter but do not require a prescription. Those serve not only to dry the nose, but to also decongest the nose. For the eyes, it's good to travel with natural tears, since sometimes you can get dry eyes, especially on long airplane trips, and they also serve to rinse out your eyes. It may be a good idea to travel with allergy eye drops like Pataday, useful for itchy eyes. Melatonin can be helped to induce sleep and reset your internal clock if you have jet lag. To control pain, you have the option of Tylenol, which is also known as acetaminophen, or NSAIDs, which uses either ibuprofen or naproxen. Tylenol and the NSAIDs can be mixed, used on the same day, but for the NSAIDs, you either use ibuprofen or naproxen, not both on the same day. I like to make sure that I have an antibiotic cream, something like Neosporin for cuts and scrapes. Cortisone is useful for anything that is itchy or rough or red or raised. Benadryl gel for any itches, especially poison ivy. Lotrimin or any other antifungal for either baby diaper rashes or ringworm. An oral pain medicine in case of a toothache or mouth trauma. In case of tummy issues, always carry some Pedialyte. The best way to have it is in those powder packets. On vacation, we tend to overeat, so having a little bit of Pepcid on hand is a great idea. I like to use the chewables because they can be cut in halves or quarters and given to children. A good rule of thumb is that if you have vomiting or diarrhea for longer than 3 days, or you have anything that's bloody, either vomit or diarrhea, then you need to seek immediate medical attention. Imodium is a good antidiarrheal, but can only be used in adults, and should never be used in children unless you speak to a provider first. Include things such as Band-Aids, ice wraps, alcohol wipes, cough drops, gauze, ice packs, lip balm, pulse oximeter, and if you don't know how to use a pulse oximeter or what parameters are normal, watch my short. Always travel with a thermometer. Last but not least are the prescriptions that you should consider asking for from your provider. I typically request that my patients schedule with me approximately 2 weeks prior to any overseas or long travel where they feel that they are going to need medications in order to travel safely with their families. I especially recommend these pre-travel exams for my families who have children with chronic illnesses. It's a great opportunity to review the chronic medical condition and also educate. If you would like a copy of my travel first aid kit to review with your provider, email me and I will be happy to send you a link. Safe travels this summer and always.